I have the privilege of getting to work in so many different settings, doing leadership-related work, and in more than a few, people may say kind things about me, and I will make a reference to, actually, my wife taught me that, Lisa helped me understand that, she instructed me in that, and they think I'm being falsely humble. Then they meet Lisa and go, she really taught you that. And they come back, and it is true. So I'm so grateful for you for that, Lisa. But actually, you are known by many people here as well. Obviously, I know in a particular way for your highly developed skills for navigating difficult mental health systems, like Dr. Molly referred to help members of your own family and non-family members with serious mental illness. It wasn't take care of my own first, we'll get to them after I take care of my own. It was my own and them are all mine. And the question would be, how do you manage, and what have you learned about being an accompanitor when it may feel overwhelming, when you're not sure if it's working or not, and you're holding together as best you can the personal as well as those beyond your own inner circle?
Can you hear me? Yeah.
Yes.
Okay. Thank you for that question. Well, thank you first to the professionals here on this dais with me. You guys are my first go-to when I'm accompanying someone is how do I navigate a system, or how can we get to a doctor? How can we get some peer support? So you have all of my deep thanks, because we need you so much. Thank you.
Lisa, if you could keep it close, please.
I will. All right. However, that said, I have been accompanying with people with mental illness for many years, beginning probably with my son, who suffered profoundly with schizophrenia, and most of his time with that was not fully treated. And it's interesting when we talk about the desire to accompany and to help others, that I was always struck by, even in his misery, if you will, or his sometimes non-compliance, he almost always would call me up and say, hey, when we go to this agency today, could we bring my friend with me? I think he really needs to see the doctor too. And so something about wanting to be an accompaniment with others. Jonathan, you talked about that so nicely. Even when we are recovering, or people are recovering, there's value in what they can bring to the next person on the road. So the hard stuff, or when it doesn't work, and I will be honest, many times it can feel like it's not working. I've been out to visit this person many, many times, and it doesn't seem like a lot is changing, except maybe the location. Accompaniment can be a very, very long road. And traveling towards recovery requires what I have learned from social worker Dave Pallone as 3 things. It requires people, requires places, and it requires purpose. People to love, and people who will love us. People that we can care about, and people who will care about us. People that we can seek for a prescription or for a ride or for a phone call. People. That recovery road requires places. Minimally, a safe place to live. But it can also include places to heal. Freddie talked about the community centers that they are working to develop, because we need places to heal and to belong. And sometimes we even need a place in a hospital, and that's a place of healing too, and probably the hardest bed to get. Mm-hmm. But as an accompanitor, I feel like I'm always striving to help people that I'm with find people, find places, and find purpose. And I'm not just talking about work as purpose. I'm talking about something that people want to get up to, something that gives meaning to someone's life. It could be volunteer work, like I do. It could be your pet. You're getting up just to get your pet out for the door for something. It could be another person. It could be an art project. It could be a book that you're writing or a song that you want to sing. But people need a purpose. And when they have those three things working well together, I think that we have learned they are going to stay on a road to recovery and achieve that recovery for a longer period of time and maybe even forever. So when I'm overwhelmed and it doesn't seem like anything's working, I have to reflect on who, where, and what could change to keep someone moving forward on that path to recovery. Maybe the who is, all right, we got to find a new doctor here because this is just, they're not connecting, something's wrong. Oftentimes I will say it is the where. Okay, you're out on the street again. You don't have a place to live. We need to start finding, let's get down to frontline services. Let's go over to alternative pathways here in Medina County. What agency can I find that's going to help my friend get to that next place? And the what. You don't always have to have the people part solved. You don't always even have to have the where part solved. You can still be working on the what. What gives your life meaning and purpose, even if you aren't exactly sure if you're going to be staying in this place very long? Maybe for the 3 months that you're living in the recovery house, you could volunteer at the library. You're really good at singing songs. While you're living in this temporary place, could you come to the local church and contribute your voice in some way? So I don't think we have to have one intact before we start including some of the other pieces. And by the way, they're going to change a lot, especially when the location changes. I've also learned that there is an incredible power in a narrative. Telling your story to others validates it, and saying it out loud enables us to acknowledge so many emotions. It can also open the door to new people and new ideas that might actually reduce the pain at the center of the story. And hearing those stories of others is powerful too. I have seen so many people come to NAMI support groups and grow stronger just by sharing their own story, even when the circumstances didn't change. And hearing other people's stories, that somehow there was a strength in that. We had a very brave woman. I think she was here this morning. She's going to be back with us tomorrow, and she said I could share her story. For almost a year, she came to our NAMI support group and struggled with her adult daughter's descent into psychosis. Complicating it was that her daughter lived several states away, and she couldn't get to her and didn't even know how. It was painful for everyone to hear and watch. And yet, despite the unchanging circumstance, the mother has seemed stronger now. So strong that just before Christmas, she contacted me and said, I've never done something like this, but I'm going to get on a plane. I'm going to go to Phoenix, where my daughter is, and I'm going to try to find her. And so she headed off, and she said, and I'm hoping that she'll come back with me. So we texted back and forth, and interesting that it was Phoenix because, of course, we know that they have a mental health ministry there. And probably day 2, we got some difficult news. Doesn't look like she's going to come back. Doesn't look like she's even going to talk to me. And I just feel so alone right now. So Dobie and I called up the office down there in Phoenix, and 2 of their mental health ministers reached out to this woman and prayed with her and talked with her, and she came away feeling like she had a friend in that city, and that if she had to call someone, maybe they would be the place she could call. She told me how much relief that gave her. And she returned, and she was not able to convince her daughter to come along, and I don't think the story's over yet. But when she came to the next NAMI support group, everyone applauded her. And over, people were telling her, wow, there seems to be a new confidence in you. You're just holding yourself more assuredly. And she said, you know, I did something I never thought I could do. And I don't know if I'll, at my age, be able to do it again. But I can rest now knowing that I did everything I could to reach out to my child. I think that's an example of accompaniment, first from our mental health ministry here, but then it extended all the way to being able to reach out to Phoenix. Thank you for that. Telling someone's story is also another way of being an advocate. How that story is told can really change what services they get. Sometimes you need a quick overview to give to a provider. And I think as an accompanitor, I have learned to help individuals kind of curate that story. If you only have 15 minutes to meet with Dr. Molly, you don't get to tell your whole life at one, and in a 45-minute session. You may have to figure out a way how to curate that down to significant things that are going on. And I think as accompagnators, that's a really special place we can have in helping people share their story at length with us, and then maybe helping them figure out how to tell that story more succinctly so that they can get some services faster. Oftentimes people find themselves in an emergency room with someone that they love. And again, they want to get that person in as quickly as possible, but people are not able to hear everything that they have to say. So we've even worked, I know NAMI has given me a lot of support on creating templates so that people can kind of outline the symptoms that they're seeing and be able to hand them over to someone quickly. So there's a lot of power in that, and you don't have to be a doctor or a professional to do that. You have to be able to listen and then say, hey, let's figure out a way that we can make this a manageable outline so that when you get there, you can present the story. And I also think helping others gives them a voice too. When you help people tell their story, you're giving them a voice to advocate for themselves or for their family members. So when things don't work for me in terms of the help I'm trying to give to someone, I think I have to embrace humility that I don't know. And then I don't know a lot of this, and I have to seek out some help in learning more. Most of the agencies that you see around here, I have had an honor to interact with, and part of that is because I didn't know something, and so I had to learn to reach out to various agencies and say, can you help me with this? I don't understand how the housing works here. Can you help me? I don't understand how the medical system is going to process this. And having that humility to say, I just don't know, and the willingness to reach out for answers has really, really assisted me, even when I'm feeling most discouraged with someone. And that leads me to the power of partnership. Again, I'm talking about learning from all of these agencies, but I think that there is an incredible value in learning to partner with one another, with agencies partnering with one another, with people partnering with one another. We can have some incredible teams, like ACT teams, that maybe see people on a more consistent and frequent base. But even in those systems where you have people being visited and seen by professionals at the highest level of care, you might be talking about seeing the psychiatrist once a week, the therapist once a week, the nurse maybe comes out once a week. Maybe there's a peer supporter that's going to be involved once a week. Let's say on a good day we have 5 people on a team. That's still only maybe 5 hours a week. And people who are suffering with mental illness need someone more than 5 hours a week. I think that is where all of us who choose to enter into accompaniment have a very special role, that we can be that person to walk along with someone when they're not at the doctor, when they're not visiting with their therapist, when they're not getting down to the agency. So we need to learn how to partner with those agencies and with each other. And I'm so thrilled because all of these agencies are here now, and I think they're talking with each other because they acknowledge that they can't do it as well. It's wonderful to have a place like Magnolia Clubhouse or Future Directions that we know we can let folks go to when they need a place to be that's not their doctor, not their hospital, not their treatment facility, and know that they can be safe there and maybe even find some purpose there. But we all need to know about each other so that we can refer one another to those programs. One of the partnerships that we've done at St. Ambrose has been with Safe Havens. Are they back here? Can you guys raise your hands? There they are. Okay, they're part of Frontline Services. And we got to know Safe Havens during COVID because our family was very concerned about who might not have Christmas that year. And our family made an effort to start providing Christmas for these 2 group homes. And we loved it, and we still do, but I was concerned about having something that would outlive the Moser family. And so I brought it to our team in partnership and said, what do you guys think about us beginning to do Christmas as a team for Safe Havens? I think we're on year 3, and that partnership led to our Catholics Works of Mercy saying, hey, we can give you a lot more than a meal at Christmas time to take down with your presents. We could give you a meal every month. And our team has now been taking, for about the last 18 months, a monthly meal down to both of the Safe Havens group homes. That partnership is not just for the clients that they serve, but it's for the staff as well. Because Dan, we want you and all of your staff, Anthony, we want you guys to know that we value you. And your work is so important. And we know you don't get to hear that a lot because some of your clients are very ill and can't say that to you. And so we want to partner to let you know how much you are appreciated. We also have a new partnership with a good father who's a missionary out in Cambodia, and I think he's watching us virtually. And that power of partnership got extended when he came to visit, wanted to learn about our mental health ministry, and I had to immediately take him down to Safe Havens so he could see what a group home looked like and what they were doing to help some of the people with very serious mental illness recover. Likewise, I was able to take him out to Magnolia Clubhouse, and he was so happy when they gave him the worldwide map, and I think he found one, Anthony, at Magnolia. Do they have one in Thailand, a clubhouse? Yeah, that was the closest, but it gave him hope to say, wow, there's a clubhouse there. Maybe I could get one started in Cambodia. So when things aren't working, it can lead us to despair. And hope is a powerful antidote to despair. Partners in Health even includes that in their mission statement. And Dr. Sheila Davis encourages one to find action that can demonstrate that hope. I have learned that being present is an action of hope. Just to listen is part of that presence that can give hope. And this steady presence becomes accompaniment that says, you are not alone. I recently invited a very devoted father to this conference, and I think he's with us virtually, so a shout out, Roy, if you're there. He and I have been trying hard to move his son forward into recovery from serious mental illness, and there have been so many disappointments. But citing this conference theme, I said to him, I know that accompaniment may not cure the affected individual or even drastically change the situation, but I do know that it can be evidence that there is hope and that the person and family are not alone. I have come to see my journey with your son as accompaniment, and I am honored to be included on that journey. Today, my hope is that the doctors, social workers, professionals, volunteers, ministers, everyone here will come away with a desire to see accompaniment happen more for those who are living with mental illness and their families. In my own son's last week, his compassionate psychiatrist pulled me aside and observed, your son suffers profoundly. Yes, I agreed, but not alone.